Hi, Dr. Camanor. We're here with Dr. Heegard and Raina Wilson, and we're thrilled to be at JFK Hospital, and we'd love to hear a little bit about the background, the history, your background. Just fill us in.
Good morning and welcome to the nation's largest teaching and referral hospital. It's an honor to have you here. We're the friendly and warm hospital people in Liberia. Great to have the Enova team and our sister Rena back and visiting us. The John F. Kennedy Medical Center consists of 4 institutions. We have the John F. Kennedy Memorial Hospital, which is opposite us. And then we have the Liberia Japanese Friendship Maternity Hospital, which I think was established in '83. And then we have originally the Catherine Mills Mental Health Hospital, but during the war it was destroyed. And through the kindness of one Dr. E.S. Grant, a psychiatrist, he gave his clinic to the government. And we also have the Tubman National Institute of Medical Arts, where our allied nursing, midwifery, lab technicians, radiographers, and soon anesthetists, nurse anesthetists will be trained. It's a big family, it's a big ship. And this ship is steered by a very able and capable captain, Dr. Jerry Brown.
Who we met last year.
Yes, an incredible person. He's a surgeon, a general surgeon, a very good surgeon. And he's also we're very proud of him. He's our Ebola hero. He was very brave during Ebola. And he ran the ETU that saved many Liberian lives.
He was also Time
Man of the Year.
Of the year 2014.
14. Yeah.
For his work on Ebola.
Yeah, incredible.
Which is incredible.
And I'm a pediatrician. I trained in South Africa. I've been in JFK for 7 years as a pediatrician. And I'm also the acting head of department for the Department of Peds at the medical school. JFK serves as the referral hospital in that when any other hospital fails or they are unable, they refer to us. The John F. Kennedy Hospital has a capacity of about 500, but we're probably only doing about half of that.
Well, we saw there's a lot of construction going on and rehab.
Yeah, we haven't maxed out capacity. The maternity hospital has a capacity of about 200, and that's being used.
And you're also affiliated with a medical school.
Yes, definitely. Being a teaching hospital, we're affiliated with Tubman National Institute of Medical Arts. JFK runs that program, and we offer allied and nursing diplomas. Then the University of Liberia Medical School, AMWRT, College of Medicine.
This is a public hospital.
Yes, it's a public hospital. It's a government hospital, and as chief medical officer, I play a role at the medical school as an associate dean. So
how many doctors are being trained at the medical school now?
On average, last year we had about 39 graduates. So on average, it's between 30 to 40. The largest class we had, I think, was 42. For a population of 4 million, with only about 300 doctors,
That's
we are
what
way
I
behind.
wanted to actually get out.
We have a ratio of 1 to 15,000.
You guys are working your tails off.
Yeah, so.
Ratios of patient to doctor that we can't even conceive.
I think it's 1 to 15,000. So medical school is working hard to produce more doctors.
Yeah.
Memorial Hospital, we have internal medicine, peds and surgery. Maternity is OBGYN in a mental hospital. So we have quite an army, but we still need more soldiers.
We're getting a sense of how critical the need is.
I've been here for 7 years. This is my 8th year. And the changes that I've seen within a year of the new administration, Dr. Brown's leadership, has been exponential. It's one thing to have good skilled doctors, but if the environment, if the site or the facility is not acceptable, it was demoralizing working in a rundown. But we realized that if there's any other major disaster, be man-made or natural, we may get caught out. So we're working really hard to make sure that we are prepared
for mass disaster.
In case of mass casualty.
Yeah.
We're doing well, but we're not resting on our laurels. Liberians are incredibly resilient, and when I say that, if you think of the history of the country, even what went on before the Civil War between the Liberians and the indigenous, and then the Civil War, and then Ebola, and you find people still happy.
Yeah.
They will take any reason to have a party. It was just relative to the amount of stresses that we've been exposed to. You would expect a lot more depression and suicide. Unfortunately, it's not I don't say it doesn't exist, but it's not so florid that it warrants. The suicide rate is low, fortunately, and because of the coping mechanisms, I think we still have a extended family.
Yeah, sense of community is clear.
And Nigerians are expressive, and we have a wicked sense of humor. So I'll say Nigeria is a nation of firsts. We are the oldest independent state in Africa. So the first female president, like demographic survey, we were the first country to do our own survey independently. Yeah. And probably the first footballer to be a president. So, and coincidentally, I am the first female medical officer of the job.
Well, that's kind of a
I was getting to that.
Yeah, so a lot of firsts. That's fantastic.
Yeah, so
you have the highest rate of pregnancy of any country in the world.
That was it. We were number one with 38% of teenage girls being pregnant. 2 out of 5.
And then you also have one of the highest mortality rates, maternal mortality rates.
So our maternal mortality is high. I think it's 940 or so. Prior to Ebola, we were making some gains. The previous Millennium Developmental Goals, we were really working hard with regards to maternal mortality and child mortality, slashing it by 2/3. But after Ebola, not just the loss of lives, and in Ebola also there were a lot of high women affected, or even just because of closure, lack of access to care, and the fear in health workers. So, Ebola itself probably killed half the number of people. It was failure of systems and lack of access to hospitals closed down, doctors were afraid. So people were communicable diseases, other infectious diseases died because they couldn't access care. I applaud and I tip my hat off to those who worked in the ETU, but I also like to do a shout out to the unsung heroes. Those who were brave enough to work in hospitals, without any armor. And those are some of the untold stories. The doctors and nurses that had to continue and face danger every day.
It's incredible.
It was a difficult choice because at that time I was heading the peace department. We were able to set up our own protocol, and we trained our nurses how to don on and off. And we actually trained the whole hospital. We had to be working while others were well armored, and here you facing this invisible enemy. So we just did some practical things. We kept a meter away from patients. We would wear a light apron and gloves and masks. And when you do procedures, you wear the whole when you're playing with blood and fluids. But we had to make difficult calls. So there was one baby that came from an area that had Ebola. She was only 2 months old. And the family, there was this indirect, long-winded connection to someone who died from Ebola. Then this baby was septic and needed oxygen. And my gut told me, this kid's not okay. And I had to make that very difficult decision and say, isolate this child. And our isolation, we couldn't get oxygen. And I got a lot of flack from my nurses and my junior. Like, doc, it's this baby. And I said, put it away. And within 12 hours, the baby subsequently died. And within 12 hours, we got the results. And the baby was Ebola positive. We would have put that baby among other mothers and children. And a minimum of 8 people would have been exposed. So it was a very difficult time. I was just speaking with Dr. Brown. He mentioned that there were some positive things that happened after Ebola, some positive lessons. Because of the level of hygiene and the level of chlorination, we haven't had a cholera outbreak since Ebola. Obviously, nobody wants Ebola. We thank God it's gone. But it taught us to wash our hands. Mm-hmm. It taught us hygiene. Right. Common soap and water, common chlorine or chlorides can protect you. One of the indicators, the status of a nation, maternal mortality rate is one of the health indicators, as well as the under 5 mortality. Mm-hmm. So you cannot claim to be developing You're not paid to be doing anything if your women are still dying in childbirth. Something that is natural and something that's not completely predictable, but something that's preventable. No woman should die during childbirth, and that's a basic human right.
The Minister of Health is a general practitioner with emphasis in obstetrics. And I just want to say again that as an obstetrician myself, every hospital and clinic we went to yesterday, which we covered a lot of ground, that you could tell that was a major focus.
Yes.
In our country where we have still abundant resources, we're moving in the wrong direction. So I was impressed.
The absence of a woman in the home is a disaster. Women build a nation because they build the homes. They nurture children and they nurture husbands. And so once you have a mother out of the home, that pillar is gone and the home is unstable.
Healthy women make for healthy families, make for healthy communities, and a healthy country, and hopefully a healthy world.
Once a woman is educated and she's empowered financially and she's healthy, the family does better. What you put in is what you get out. If we want to be a thriving, a vibrant, a prosperous and a healthy nation, it has to start with looking after our women and our children.
I would like to get your perspective on why you consider to be the reason why we have such a high infant mortality rate.
So there are different factors. Within the first month, a lot of them are maternal. Factors that affect the mother will affect the life of the newborn.
Yeah.
A lot of it has to do with the health of the mother and her access to care prior to delivery. Her care during actually before she got pregnant. What was the state of this woman?
Right.
If she's malnourished, if she's stressed out, if she has an underlying infection, if she has malaria, HIV, hepatitis, whatever, and she's not diagnosed and not treated, and she gets pregnant, it will affect her pregnancy. Then during the pregnancy, what care did she get? Did she get routine care, checking her blood pressure, her urine, we do malaria prophylaxis to prevent malaria, because we know malaria can cause anemia, it can precipitate labor and cause a premature and low birth weight. And on that note, I withhold further.
Doctor, thanks a lot.
Thank you.
It's really wonderful.
Thank you so much.